Hi, I'm Heather Wademan, Quality and Compliance Manager at Positive Impact Health Centers.
Hi, I'm Karen Cross, and I'm the Director of Client Services at Positive Impact Health Centers.
Hi, my name is Pranusha Dubakka, and I'm the Health Informatics Manager at Positive Impact Health Centers.
Hi, my name is Darren Wright, Patient Navigator here at Positive Impact Health Centers. We're part of the Ryan White Impact Now Collaborative.
Dear Georgia, for over 30 years, our dedicated staff, leadership, and board of directors have worked together to provide client-centered care for the HIV community to have a life worth loving. Our 3 service locations in Decatur, Duluth, Marietta, and our administrative office in Chamblee have helped us reach across Atlanta to bring our wraparound services to communities who need it most. Our strategic plan is guiding our pathway to getting 15,000 people into care in Georgia. We service 20 counties across Metro Atlanta and offer clinical care, prevention services, client services, emotional wellness and recovery, pharmacy, and oral health, providing pivotal services to the Atlanta community. Our Community Advisory Board provides valuable feedback and insight into the work we are doing and best practices for keeping our patients at the center of our work. The magnitude of our efforts is in huge part possible because of the commitment and donations of our community sponsors, donors, allies, and fellow agencies in the fight to end HIV. Our relationships with other organizations strengthens the impact we all have to fight stigma and make Georgia a great place to live and thrive. We are a nonprofit organization staffed and supported by strategic thinkers, problem solvers, and people who never tire in their desire to assist others. Thank you for helping us create lasting change through your donations, support, and engagement with our efforts. Let's end HIV in Georgia together.
Right. So Positive Impact Health Centers offers so many different types of services. Medical care, outpatient counseling, outpatient substance use, medical case management, pharmacy, laboratory services. I feel like I could go on and on. And it's because I've been with the agency for such a long period of time, I have seen us respond to the need. And what we discovered early on was that individuals seeking services, once they enrolled and felt comfortable at PIHC, they wanted to have all those services under one roof. So, where we started out being, maybe only offering medical care or only offering HIV testing, now we offer such a complement of services, both on the prevention side as well as on the Ryan White or the HIV care side. PIHC is very fortunate that we, for a long time, have had a diverse amount of Ryan White funding. And currently, we receive Ryan White Part A, Ryan White Part B, and Ryan White C. Like a lot of our staff, I get a gazillion emails, and and sometimes you miss important ones. But this actually came from CQII. I got an email from them inviting me to be a part of their design team. So a lot of times when they have these new learning collaboratives, they want individuals from around the country to be part of designing what the tools are going to look like and giving feedback as to how to implement a learning collaborative on the ground. And initially I was like, oh, this has got to be like, not a joke, but really me. And then, so I went to my boss and I said, what do you think about this? And he's like, seems like a great opportunity. So without having a lot of context, I went to Rockville, Maryland a few months before the collaborative actually got started. And that's kind of how we even knew about the collaborative. And it was such an excellent opportunity for our agency. However, we're all busy, right? Everybody, has pulled in a lot of directions and wears many hats. And it did take a little bit of this is going to be a great, opportunity, sort of my elevator pitch, that it was something that was going to be so beneficial for our community. So I had a little bit of an edge there, but honestly, the agency leadership was very supportive of doing this. So And it certainly helped that HRSA had selected us, so that put the agency, in sort of a spotlight. You can't really say no to HRSA. Just goes to show you really do need to read your emails and check them, because important things come about that you might miss otherwise.
Our goal was to increase viral load suppression among our client population to 96%. We started off at 90%, and as part of the collaborative, they wanted us to raise it 5% or at least to 90%. What we wanted to do was identify and address barriers that might be impeding people from becoming virally suppressed. And one of our other goals, a more long-term goal we have, is to try and find predictive measures that would help us be able to put supports in place as soon as people enter care, so that we might be able to speed up viral suppression. Internally, overall, what we saw was a lack of coordinated and consistent communication that might be a root cause to some patients becoming viral suppressed. That we felt stemmed from a couple areas, such as patients changing contact information or not having phones, so we weren't able to be in communication with them, or inconsistent workflows and communication methods within the agency. We selected our interventions by looking at primary and secondary drivers. The primary drivers were patient barriers and system barriers. Secondary drivers were social determinants of health, such as lack of peer support, lack of involvement in decision-making, and system barriers like clinic and patient relationship, our data in the EMR, internal work processes. Right. Our first hypothesis was that gaps in services might go down if we were able to be more consistent with our communication with patients who missed appointments, and that timely rescheduling of missed appointments would increase attendance at the rescheduled appointments. We took one provider at our Decatur location and worked with their MA to have them track people who'd missed appointments and go back and look and see if they'd called and canceled and been rescheduled, and if they hadn't, then they would call them and get them rescheduled. But as we went into that and started looking at it, what we realized was we didn't know a lot about why those patients were missing appointments. We didn't know if it was a one-time thing, because everybody misses an appointment here and there, or if there were patients who consistently missed appointments. So we decided at that point we needed to get more information about what was happening. For round two, we had our data team create a report that identified patients who had missed an appointment in the previous 3 months, had not already scheduled an appointment in the next 3 months, had a positive score on the PHQ-2 or 9, had a 3 or greater on the acuity scale, and were not virally suppressed. We ran that weekly, and we sent it to our retention team, who would go through and make contact with the patients.
I think the agency is moving in a good direction for as having people that are working at the agency that has lived experience, as well as having cab members with lived experience, and also being a voice for the community for those that may not be willing to talk about it or be willing to have the freedom, or yet are bound by the stigma of speaking out against what's going on and not able to be that voice at the moment. But sooner or later they will hear what they need to hear and get to the table and be a part of the work that we're doing. My role was to reach back out to our cab to keep them informed on what we was working on, give them up-to-date detail, along with myself and the other staff members. We was able to come back to the cab and express to them what we was working on, and they was really enthused about the idea of us working on this project and found it very interesting for us to know that we were striving to work on this project, and we did not leave them out, but we included them by bringing the information back to them so that they will be informed on what we're doing here at Positive Impact Health Centers. The agency should do it, continue to do what they're doing, continue to reach out, continue to keep the cab involved, continue to keep the consortium involved, and most of all, keep the employees that are here with lived experience involved so that they will have an important part to play at the office, and not only in the office, but out in the community as well on a daily basis.
So Positive Impact Health Centers is always focused on getting all of our patients the care that they need. Our viral suppression rates were always good, but at the beginning of the collaborative, we thought of putting our goals at 96%, and we averaged at about 92-93%, but there were highs and lows. But I'm glad to report that our lowest was 90%, which is great. So we started off with our baseline data from March 2023, and it was about 91%. And then we were required to submit it every 2 months. So we had about 8 values altogether. And initially it was slowly going up, and then we saw a spike to about 95%. We were curious about the sudden spike. We looked into our data internally. We saw that there were a lot of rapid entry people that were taken in during that time. So a lot of new patients in care. And then when you get new patients in care, it takes a while to get them virally suppressed. So our next viral suppression data went back to 92%. And there were a lot of highs and lows, but we ended up at 96%. I think this is due to the fact that we worked on keeping our patients in care with the retention team. It helped keeping our viral load suppression high. We noticed some discrepancies with our appointment coding, things that could affect how data is being put into the EMR and the way it comes out of EMR. So some streamlining was done with workflows to help us understand the flaws with our current workflows. Although our focus was viral load suppression for this specific initiative, we were glad to get the new patients in care and get them virally suppressed by the end of the initiative. Everybody worked together to keep the patient in care.
And I think overall, it was such an awesome opportunity to showcase the incredible work that we do, as well as to partner with other local agencies and agencies around the country so we could learn from each other.
Being able to be around other agencies and understand that we are not only ones that are having issues with housing, transportation, viral suppression load, people not making appointments.
It was very refreshing to see more people that were traveling in the same boat as we were, to see that we were not alone. People were having the same kind of problems that we were having.
Also being able to fellowship with my wonderful colleagues here and to bond with them.
Even internally, within the organization, we felt like we learned so much about each other. I feel like most of the times we were working in silos. We feel like, it's a different department, doesn't concern me. But we understood that working together is really important to get all of our patients to care and to get them the care that they deserve to live their best lives.
My main takeaway from this is that, yeah, viral suppression is very important. We want everybody to be viral suppressed for many, many reasons. However, that's not the only factor you should look at to see if you're successful in engaging with the community and getting people into care.
Also learned during the process that viral load suppression rates are not the only factor to be looking at when we're looking at HIV care.
Also was able to understand more about the data, understand how the fishbone work, how the importance of collecting data and measurements, and understanding the importance of this. That measurement does have an important part in our everyday work, because this is how we're able to reach our clients and see where we're shortcome, where we need to improve, and where we need to really work on to make sure that we're providing top services for our clients as well as for our staff.
The Impact Now Collaborative is the first learning collaborative I participated in, so it was quite a learning experience.
So, and I, did not have any actual experience being as part of the learning collaborative. Other staff had. This was my first time being a part of that.
Overall, we learned a lot.
It was definitely a win-win.
And if you're ever in the Atlanta area, please stop by and see us at any of our locations, our Marietta location, our Duluth location, or our Decatur location, or you can always stop by our Administrative location here in Chandler. Thank you.